Now, when we talk about obsession, again, this is important to understand. First is we talk about the form, that is the structure of phenomena which is there. And second is when we talk about the content of obsession. Content means that what is the meaning reflected. So form may be that what is it, a obsessional thought, is it a obsessional image. So what form of obsession is occurring, that is form. And content is basically reflecting the meaning. For example, a person is having obsessional thoughts of contamination, so here contamination would be the content. So let's understand first the form. Again, this these different types of forms we've gathered from Sims, and also a very famous article by Salman Akhtar, Phenomenological Analysis of Symptoms of OCD. So some of those resources we've taken, and let's discuss some of the important forms of obsession. So these can be obsessional thoughts, obsessional images, these can be obsessional impulses, ruminations, fears, doubts, and there are maybe certain miscellaneous obsessions as well. Now first let's talk about obsessional ideas or thoughts. Again, these may be simple. For example, the person may be having few notes and they may become repetitive and restricted, and sometimes they may be complicated. For example, there may be few words which are repetitive and the person tries to resist them, and they may become more complex and maybe ritualistic. Now at times these may also be having contrast thinking. For example, the person is compelled to think of the opposite of what is said. For example, somebody says God is great, so the person is compelled to think ate his dog. So this may also be contrast thinking may be there. Then second is obsessional images. Here the person is having repeated images. So these are basically images come before the mind's eye. So they may be vivid, but always known by the patient to be product of his own mind. This he knows, he considers them to be his own. And at times they may be so vivid that they can be mistaken for pseudo hallucination. Again, we've talked about pseudo hallucination. Also, they occur in the inner subjective space, in the mind's eye. So at times these may be difficult to differentiate from pseudo hallucination. Although we know pseudo hallucination would be more clear, more vivid, but sometimes even these obsessional images can be very vivid. So one should be able to differentiate between obsessional images and pseudo hallucinations. Now, when we talk about these images, D. Silva in 1986 he described four types of obsessional images, and this we can remember with the mnemonic OCD2. So O is obsessional image, C compulsive image, D. So there are two D's: disaster image and disruptive image. So just have an idea that even these obsessional images can be of four types. So first we'll talk about obsessional images. Now these repetitively unwanted intrusive cognition, for example, images of blood flowing, images of injury, images of something bad has happened. Sometimes patient may have images of his own dead body or his graveyard. So these are obsessional images. Second is, so O is obsessional image, C is compulsive image. Now, what are compulsive images? Here, these depict compulsive behavior by rectifying either an obsessional image. For example, a person saw a dead body of a person, and the person then is had to imagine that person is standing and is alive, and they may be independent compulsive image. So these are compulsive images. The next is disaster image. Now disaster image, as the name suggests, so sometimes compulsive checkers who not only fear that disaster will occur. So sometimes we'll talk about this, that person who they are checking the gas knob, thinking that what if there may be a disaster may occur if they don't check it, or they don't switch off the gas knob. So here the compulsive checker, they not only fear that disaster will occur unless they check, but they also see the disaster happening in their fantasy. For example, the house is burning if they don't go and check the gas knob. So these are disaster images. So such images can occur. And lastly, disruptive images. Now these disruptive images, they may intrude while compulsive rituals are being carried out and they necessitate the ritual being recommended. So these are disruptive images. So these are important images which De Silva had classified. Now let's discuss the other forms of obsession. So next is obsessional impulses. So impulses we know are urges. So here the obsession, they occur as a strong urge to carry out action which may be trivial or socially disruptive or even assaultative. So patient is having certain urges or impulses, for example, to slap someone or to do something that may be disruptive or socially inappropriate. So this is obsessional impulses. Now these obsessional impulses may be to touch or to count, to arrange objects or to commit certain antisocial act like we discussed. So these are obsessional impulses. Now these are unusual to carry out these impulses except for obsessions with suicide and homicide in a depressed patient. So usually the person will not carry out, but sometimes we see that obsessions with the suicide or homicide, in depressed patient, they may actually carry out. So these are obsessional impulses. Next is obsessional ruminations. Now often they may be pseudo philosophical ideas, for example, why the sky is blue, where is God, why the earth is round. So such pseudo philosophical ideas, they may be irritatingly unnecessary, and they may be repetitive, and they may not achieve any conclusion. So patient may have such obsessional ruminations, and the person may spend a lot of time in these obsessional ruminations. Next is obsessional fears or phobias. So these consist of groundless fear. So here the person is having such a baseless, groundless fear, which patient realizes is dominating without any reason. Now, unlike obsessive impulses, there is no actual urge involved here. So here there is no urge. The person is just having certain fear. For example, the person is sitting with his boss with certain other people, and the person may have obsessional fears that discussing his interpersonal issues of his wife with the boss, although he has no will to discuss such a thing, but the person may have obsessional fear that what if he may do. So this is obsessional fears or phobias. The next is obsessive doubts. Now, an inclination not to believe that a completed task has been accomplished satisfactorily. So person may have repeated doubts, so whether he has not completed a particular act. Now, in miscellaneous, there may be certain other obsessions or different other forms of obsessions may be described under miscellaneous. So these are obsessional in nature but unclassified in other categories. For example, a person is having a tune in his mind which he is not able to forget, is not able to get rid of from his consciousness. He is having a song in his mind which he is not able to get rid of it. So these may be described under miscellaneous forms of obsession. So these were some important forms of obsession. Now let's understand some of the important content of obsession. So this may be dirt and contamination. So person is having repetitive thoughts of dirt, contamination, whether my hands are dirty, things around me are dirty. Or there may be certain aggressive obsession, having aggressive thoughts to hurt someone or to do something which may be antisocial. And then inanimate or impersonal obsessions can also occur. Obsessions related with sexual content, that may also occur. Religion, sometimes people may have obsessions of doing something socially inappropriate in front of God or saying bad words to the God. So such obsessions may occur, and then there may be certain miscellaneous obsessions as well. Now earlier the common themes were more of sexual obsession. So in surveys, over the years it was seen that earlier the sexual obsessions were more there. So people were worried about these sexual obsession. They were worried about sex, so there were a lot of sexual obsessions. And nowadays there is a concern with fear of doing harm. So modern time the person maybe we can say that is preoccupied with aggression. So now you'll see a lot of patients may be having these fears of doing harm. So these aggressive obsessions may be there. So again, if you see the phenomenology, there may be a shift from the olden days, and in the current days when we see, there may be a shift of these content. Now obsessions, again, they can be seen in so many conditions. So first is of course in obsessional states in OCD it can be seen, and sometimes it may be difficult to differentiate it from some of the other phenomena like delusion. We'll talk about that when we talk about the diagnosis. So now even specifiers are also added, and we can see that sometimes patient is having obsession but there is no insight. So still we would call it OCD and not delusion. So it's very important to differentiate. Also sometimes even in depression, even in schizophrenia, and even organic state, particularly post-encephalitic states, patients may have obsessions. And again, one should be able to differentiate obsession from other phenomena as well. So let's talk about now compulsions. Now, as the name suggests, compulsions, these are in fact obsessional motor acts which may result from obsessional impulse which leads to directly to action, or they may be mediated by an obsessional mental image or thought.